Some children or young people with more complex educational needs will receive support through an Education, Health and Care Plan, often referred to as an EHC plan. An EHC plan is a legal document maintained by the local authority and is used for children and young people who need a lot of additional support in an educational setting. It describes your child's special educational needs, or SEN, and the help they will need to meet their SEN and prepare them for adult life. Although an EHC plan can include a child's health and social care needs, which are linked to their SEN, a child will not get an EHC plan if they have health or social care needs but do not have any special educational needs. Most pupils with special educational needs will have help given to them without the need for an EHC plan. This is called SEN support, and we have a separate video which explains how this works in schools. An Education, Health and Care Plan supports a child or young person whose special educational needs cannot be met by the resources and specialist advice usually available to their learning setting. Many children and young people with EHC plans will still attend a mainstream nursery, school or college. However, a child or young person will need an EHC plan to go to a specialist school. So, just to be clear, an EHC plan can only be issued after an EHC needs assessment has taken place. However, not all EHC needs assessments will lead to a plan. If the assessment identifies special educational needs or a disability, which the local authority feel can be reasonably met by the nursery, school or college, then they won't issue an EHC plan. A parent, carer, person with parental responsibility or a young person over the age of 16 years has the right to challenge if they disagree with the local authority decision. The purpose of an EHC plan is to make special educational provision, which means support, to meet the special educational needs of the child or young person, which were identified in an EHC needs assessment. The purpose is also to secure the best possible outcomes for the child or young person across education, health and social care, and, as they get older, to prepare them for adulthood. Supporting children and young people with SEN or disabilities to prepare for adult life may involve helping them to achieve the best outcomes in employment, further education or training, independent living, health, and also taking part in the community. By outcomes, we mean what everyone would like your child or young person to be able to achieve in an agreed time frame with the support in the EHC plan. There is a lot of helpful information on the Preparing for Adulthood website. An EHC plan can potentially support a child or young person from 0 to 25 years, as long as the young person is still in some form of education or training, except university, and as long as the outcomes in the EHC plan have not all been achieved. This education or training does not have to be in a further education college. It could be part of an apprenticeship, a traineeship, or a supported internship. The education or training does not have to lead to a qualification to be maintained in an EHC plan. The Children and Families Act of 2014 recognises that some young people with SEND will need more time and more support to achieve the skills they will need in later life. Let's just consider a few frequently asked questions. Our service is often asked if an EHC plan will bring more funding, which can help support a child in school. An EHC plan does not in itself bring any additional funding or resources. An EHC needs assessment may, however, have identified special educational needs which were not previously clear. These new needs may trigger additional funding. This will be due to your child's needs, not because they have an EHC plan. Parents and carers also ask us if their child will need a diagnosis in order to get an EHC plan. A child or young person does not need a diagnosis of any condition for a request for an EHC needs assessment to be made, nor for an EHC plan to be agreed. EHC plans support children and young people whose more complex learning needs cannot be met by the resources and specialist advice usually available to their learning setting. Some parents want to know if an EHC plan will help bring their child or young person the right support when they move up to the next setting. As we mentioned earlier, the law expects the majority of pupils with special educational needs to have their needs met through the graduated approach to SEN support. This includes accessing specialist advice with your agreement if your child continues to make less than expected progress. The specialist education services in our county of Suffolk support learning settings to support children and young people aged 0 to 25 years, and an EHC plan is not needed for settings to access their specialist help. For children and young people with SEN, it is usual to have a transition meeting between the family, the current school, and the next school before your child moves up. This is where you can discuss your child's needs in detail and explore whether any further advice or assessment would be helpful. Remember, an EHC plan will only be needed for pupils whose more complex needs cannot be met through the resources and specialist advice usually available to settings. Do visit our Suffolk Sendias website and YouTube channel to find more information and videos about EHC processes, about education and support for pupils with special educational needs or disabilities. This video was made by Suffolk Sendias, but every county has an impartial and confidential SEND information, advice and support service.